Whether to get the COVID-19 jab or not remains a topic of debate for people all over the world. Pharmacy chain Dis-chem says it is important to keep outlining the importance of vaccinations and debunking disinformation. To date, that chain's national clinic manager, Lizeth Kruger, joins me now. Lizeth, very good morning to you. Where are we when it comes to placating people for getting the jab in their arm?
I think it's going to be an ongoing education. It's not going to stop. So unfortunately, people tend to rather agree with social media, on social media groups and Facebook, than going into physical clinical evidence. So it's an ongoing battle. Unfortunately, the stopping of the J&J didn't do it very good in terms of the education, but still, I mean, it was the best thing to do from a South African perspective and from SAPRA and the Department of Health to do it and to make very clear that it's done. I think the main thing that South Africans must understand...
Excuse me, John, I mean, it plays into their fears, doesn't it? So how do we turn this around? Because the more people who are getting the vaccine, the better it is for the country as a whole.
Absolutely, absolutely, and I cannot stress more. It's not just the COVID vaccine. I mean, it's everything. So, I mean, vaccines is the only way that we can probably move forward in a more normal way. Not that I'm saying that there's going to be no mask or no sanitizing, but education. If I can urge people to rather go onto the DOH website or rather go onto reputable websites if they want to learn more. Ask healthcare workers that's really involved with vaccines, like clinics, government and private clinics. It's so important. So yeah, it is a battle, and I do believe that we're getting somewhere. And the queries that we get, we do see that it's a little bit better in terms of people being positive. Sorry, I'm in Nelspruit, and there's a lot of people. I'm so sorry for the background noise.
It's okay. It's live TV. And when do you think Dis-chem, for example, might be able to get some shots? Is that a probability? Will it happen in our lifetime?
Yeah, so we're busy. The healthcare workers within Dis-chem, which is the nursing practitioners, pharmacists, all the pharmacy staff. We are slowly getting the vaccine as well. We're also part of the Sisonke at this stage, Sisonke research project. A lot of the nursing practitioners I get the feedback from everybody. So we are definitely slowly but surely getting the vaccine as well.
And what do you see? I mean, I've just seen a friend of mine from England. He had the AstraZeneca vaccine. He said he's never felt better for about 2 days. He was on an absolute high. I mean, what are you seeing from people getting the vaccines? Is it going down well? Are there problems?
There's not really problems. I mean, there can be slight side effects. Just for interest, like I had mine yesterday, so I don't really feel bad this morning. Vaccines tend to give you a little bit of a headache or some, slight side effects. But I mean, compared to COVID and the fatalities and ending up in hospital, that's not even, you cannot compare that with anything. So
the message, no-brainer, go get that vaccine if you can.
Absolutely, yeah. We always joke, we say, as much as possible, whenever you can. So definitely, absolutely.
Thanks for talking to us, Lizeth Kruger.